everyone. Welcome to my YouTube channel. Today I'm going to be talking about medical cannabis and autism. And many of you know me as a pediatric doctor. I've been licensed in the state of California since 1990. I trained at Children's Hospital Los Angeles, where I worked in critical care transport, as well as pediatric emergency medicine at the county hospitals, a few other hospitals as well. In 2007, a friend of mine was ill and she asked me about cannabis and I didn't know anything, and I started researching it and I became quite intrigued, and I switched over from pediatric emergency medicine to working in the cannabis field. And I've been medical director and owner of Canna Centers since 2008, and I'm on multiple boards, International Alliance for Cannabinoid Medicines, as well as the Center for Scientific Cannabinoid Information. I'm also a member of the Americans for Safe Access Policy Advisory Committee and the Society for Cannabis Clinicians, and I'm a clinical advisor to a company called Camformatics. I'll share some of the research we're doing. It's very exciting. And I've also published 2 books, and my latest book is called Cannabis is Medicine. And if you like the content you see today, I ask that you continue your investigation into how cannabis is medicine by reading my book. Now we're going to talk about autism, as I mentioned. And so the CDC has found the latest numbers: 1 in 44 children. Boys are more likely affected than girls. And there are 3 core symptoms with autism. So the first is impaired communication, the second impaired reciprocal social interaction, and the third restricted, repetitive, and stereotyped patterns of behavior and interest. Interestingly, children with autism also have been found to have significant neuroinflammation and neuroimmune abnormalities, as well as an increased risk of having gut issues. And as you can see in the diagram here, there's this triad: brain, gut, immune system, and all 3 of these are affected in children with autism. And very interestingly, this is where the endocannabinoid system has many, many receptors trying to balance the messages that are being sent between these various parts of the body. Now, current treatment options. So there's 2 approved medications in the United States, both of which are antipsychotics, but they have serious side effects, both short and long term. They're both approved just for to treat irritability associated with autism, and they don't address the core symptoms. And side effects that are described include weight gain, diabetes, metabolic syndrome, drowsiness, tardive dyskinesia, which is like a movement disorder. And also these drugs can mess with your hormones, increasing prolactin, a hormone that can lead to breast growth and lactation. And these are quite serious side effects, which certainly any parent would be concerned about. Many physicians are using off-label drugs, including antidepressants, stimulants, antihistamines, anxiety drugs, other antipsychotics. And unfortunately, reports don't really support the use of these, as often they have intolerable side effects and low efficacy. A report from a while back, but I think still to be true to this day, parents are unhappy with the conventional options because they don't address the core symptoms. And this is one of the main reasons why they turn to complementary or alternative medications, just like cannabis. Now, why cannabis? So here's a picture of the endocannabinoid system. Sorry about the arrow to the right. You can ignore that. We'll get to that in a second. But here is kind of an overview of exactly what the endocannabinoid system in a simplified form is doing for us. So this top round structure is the end of one brain cell. And this pink structure down here is another brain cell. And we call this the presynaptic neuron. It's the side that's sending the message. And the postsynaptic neuron, the side that's receiving the message. And so the synapse is the space between where neurons send messages to each other. And so what you can see here are these little purple circles, these are neurotransmitters, things like dopamine, serotonin, and so on. And you can see they're stored. And upon a trigger, they get released. And when they get released, they travel in a one-way fashion from the presynaptic sending neuron to the receiving neuron, postsynaptic neuron. And so what happens is they get released, they cross the synapse, they bind to a receptor, and they basically tell the receiving cell a message. What we know now is that when these messages are being sent, often if it is too much message and overexcited, hyperexcited, or the wrong message, what happens is the receiving cell gets annoyed. They describe in the literature the cell perturbation. And what happens is the cell opens these calcium channels and allows calcium to go into the cell. The calcium inside the cell goes up, which turns on, you can see here the little plus, turns on a factory that lives on the cell wall here, which takes healthy fat and converts that fat into compounds called endocannabinoids. And you can see here, those are shown by the little green triangle. These in turn get sent backwards, the opposite direction, what we call retrograde, going back up towards the sending cell. They bind to this structure, this funny looking squiggly structure here, which is a cannabinoid receptor. And when it binds on, this tells this cell to shut down some of the calcium going in. So it lowers the calcium, which in turn then sends a message to these vesicles containing the neurotransmitter, basically saying, turn it down, dial down the message. So too much message, the receiving cell sends feedback saying, dial down the message. These compounds called endogenous cannabinoids or endocannabinoids were only discovered, the first one in 1992. This receptor, cannabinoid receptor, was only discovered in 1988. So we are in the infancy of understanding all about the endocannabinoid system. However, we know now that what it is a system that regulates the cellular messages with the intent to repair, recover, protect, and balance the cells in the body. Where we have these cells is very interesting, brain, gut, immune system, but we have them in other places as well, and that's described in my book. But in terms of the child with autism, it's very important to understand that these manifestations, these behaviors that we see, and these core symptoms are now being understood to be maybe a root cause is an imbalance within the endocannabinoid system in these three locations. So this is why it's so important for us to explore this in children with autism. It makes perfect sense that if the endocannabinoid system is heavily prevalent in these areas, and these are the areas where these children are having difficulties, we must look to see what is going on with the endocannabinoid system. Is this a target for treatment? And it turns out that it very likely is. And so remember here, we have the endocannabinoid system made up of cannabinoid receptors. So I've shown you the type 1 receptor, which is mostly in the brain. Type 2 receptors, often thought to be from neck down, but there is some overlap. And there are more cannabinoid receptors suspected, but have not been actually definitively defined. We know we have endocannabinoids. So we have a cannabinoid called anandamide, and 2-AG is another one that was discovered in 1995. These are the two mostly researched, and we have others. And then we also have the enzymes that put these compounds together and then break them down. And all of these components are very important and so interesting. So here's anandamide. It turns out that a study in 2018 from Stanford University showed that children with autism have a deficiency in their anandamide levels. And subsequently, a study in 2019 from Israel documented the same thing, as well as 2 other endocannabinoids that were low in children with autism when compared to children who did not have autism. So having a deficiency kind of explains if that's our feedback loop to tell our brain to kind of send a more calming message to stop being overexcited. And if we don't have enough of anandamide, of that message, then it makes sense that these children have an overexcited brain that is not getting that feedback. And now we know too that there was a study that showed that the cannabinoid receptor, the type 2 receptor, found in peripheral blood cells was elevated. And often what we see is if you see an upregulation of the receptors, it's because the compounds binding to them are low. So the body puts out more receptors to try to catch more of that compound that's floating around. So it's a compensatory mechanism. Now, looking at THC and CBD, two of the main compounds that come from the cannabis plant, they interact in different ways, and that's why they're both so important. And we cannot pick one as the good cannabinoid and one as the bad cannabinoid. I use both of these when I'm treating patients, and it's important to understand how they work. So remember, I showed you the receptor, and I mentioned that the anandamide or the endocannabinoid is released in response to an over message, and it goes backwards and it binds to the receptor. That binding is like a key in a lock. Well, our anandamide binds to this receptor at this site. But what's so interesting is THC also happens to fit that site. And that is how THC interacts with these receptors. Now, quite interestingly, CBD does not bind to that same site. What CBD does is it binds to a site kind of on the side of the receptor. We call that an allosteric site. And what that does is that kind of regulates what's going on at what we call the orthosteric site, or the main binding site. What's interesting about CBD as well is that CBD also works to help prevent the breakdown of anandamide. So in patients that have a deficiency of anandamide, CBD actually enhances how the body uses anandamide by blocking the breakdown so it can be used a little bit more. So it's very important to understand that THC and CBD work in different ways. THC directly targets the cannabinoid receptor, plus a few other receptors in the brain and body. CBD indirectly targets the receptor, but also works at numerous other targets. There's over 65 known targets of CBD. That's a whole nother lecture that I will have on my YouTube channel as well. Now, what are the presumed mechanisms of action for cannabinoids like THC and CBD in patients with autism? So we know that THC activates, binds to that cannabinoid type 1 receptor. And in studies, that's been shown to be associated with enhanced social behavior. CBD is also what we know as an agonist, binds to serotonin, what's called the 5-HT1A receptor, which is thought to help alleviate anxiety. CBD is also known to be a partial agonist at the dopamine D2 receptor, which is thought to alleviate some of the psychotic symptoms. And very importantly, both THC and CBD are potent anti-inflammatories and potent antioxidants. And certainly this can be a mechanism by which these patients get benefit. Now let's go look at the literature in terms of what does it say about using cannabinoids for autism. So in 2010, there was a case report of dronabinol, which is a synthetic THC-like compound, the use of this in a 6-year-old boy. And what they found was that on a very low dose of 3.6 milligrams, total daily dose spread out throughout the day, this child had significantly decreased in hyperactivity, irritability, lethargy, stereotypical movements, and inappropriate speech. And it was sustainable over time at this low dose. Also, there's been some links between 2 genetic mutations associated with autism and deficits within the endocannabinoid system. Also, there was a study that showed that alterations in the endocannabinoid system in mice resulted in autistic type behavioral abnormalities, meaning some problem within the endocannabinoid system is linked to autistic behavior. And additionally, another study showed that increasing anandamide activity at that receptors, meaning triggering the cannabinoid type 1 receptor more improved autism-related social impairment. So here's all these little kind of clues to the link between autism and some dysfunctional endocannabinoid system. Now, in human studies, we have this nice study, which I've already mentioned, but a little more detail. Type 2 receptors, the type 2 cannabinoid receptors, are upregulated in the white blood cells of children with autism. And so remember that these receptors are within your immune system, and we have immune cells in our body, and they were able to just draw blood on children with autism compared to children without autism. And what you see here in this bar graph is the gene expression percentage. So in children that were the controls here on the left, type 1 receptors, type 2 receptors, and components of the endocannabinoid system, the expression was 100%, which was what you would expect. But here you can see in the patients with autism that not only were the type 2 receptors, the gene expression was elevated, the other components of the system were had low gene expression, showing some evidence of dysfunction within the endocannabinoid system. And here we have another study that shows, which I mentioned too, the study out of Stanford, that plasma anandamide levels were decreased in children with autism. So looking at the bar graph here, the side here, this is plasma anandamide levels. The children with autism had lower levels, statistically significant compared to the children without autism. But it was so remarkable that these levels were so low in the children with autism, such that they could significantly differentiate the autism cases. So what does that mean? That means that just by looking at the level, the researchers were able to be pretty accurate in diagnosing who had autism. And remember, right now, autism is a diagnosis made by clinical evaluation, questionnaires, observation, not by any objective levels that one can check. And so anandamide levels may be a very nice way to help diagnose autism accurately. Now, in looking at the study out of Israel that also looked at endocannabinoid levels in children with autism, they found that 3 of the endocannabinoids that were checked were low in children with autism. You can see here in the bar graph, here's the control. In red are the levels of these various compounds. They're endocannabinoids in children with autism, and they were all statistically significant, which means not by chance. And this was a nice study because they had 93 children with autism and 93 controls. They were paired pretty well. These were children who had very high severity scores on autism scaling, and 80% of these patients were on medications. Interestingly, additional findings from this study, younger and thinner children with autism had lower levels of serum anandamide levels. This wasn't statistically significant, but certainly an interesting finding. There were no other significant correlations with age or BMI or gender. There were no significant correlations or associations for other conditions like ADHD or epilepsy, the use of medication, or history of prenatal complications. There was a tendency towards a correlation found with higher autism scale severity scores and higher use of antipsychotics that had lower anandamide levels, but it wasn't statistically significant. And again, I mentioned is, can we use the levels of endocannabinoids as a diagnostic biomarker for autism? That's a very interesting question. Hopefully will be readdressed as we move on in our research looking at autism in the endocannabinoid system. Now here's a report as well, looking at using cannabidiol rich, so CBD, high CBD in cannabis in children with autism. And again, this comes out of Israel. And what you can see here is that it was mostly boys, but you can see that all patients are here scored by behavior, anxiety, and communication. And so when you look here, what's interesting is that very much improved, almost to 30%, but much improved, a little bit over 30%, making it so that for anxiety, I'm sorry, this is for behavior, 61% had either much or very much improved behavior with cannabis. And as you can see, the boys are in gray. So they seem to have, if you isolate the boys and girls out, it looked like the boys responded a little bit better than the girls did, or when the girls are included in the data. For improved anxiety, they saw 39%, improved communication, 47% of patients, less medication, lower dosing, 33%. Almost a quarter of patients were able to stop other medication, and only 8% during this study had to add or increase other medication. And here's another study that came out, again, out of Israel, real life experience of medical cannabis treatment in autism. And this was looking at 188 patients between 2015 and 2017. Most were on a 20-to-1 ratio of CBD to THC. And at 6 months, this is a very high number for 6 months on a new medication, almost 83% still in active treatment. And you can see that 30% reported significant improvement, with almost 54% reporting moderate improvement, and very low numbers for slight improvement or no change. Now, 25% reported side effects. And the most common was restlessness. And what I'll say to that is, when someone's in a study, you kind of have to follow the study protocol. In real world, treatment, when I'm treating a patient, I adjust the medication based on the child's response. But in a study, you're trying to keep the child in the study, and you're not necessarily personalizing the medication for them. So this is likely why they saw this restlessness. We know CBD for many patients in lower doses can ramp up, be overstimulating in a child who's already overstimulated. That can be very difficult. And I'll talk more about this towards the end of the slideshow, but I certainly think this may have been dose related. I do see this, but I prepare parents ahead of time that CBD can be overstimulating in lower doses. And what does that mean? Well, you're going to go higher dose, because we know that CBD in higher doses can be calming and even sedating. So it's counterintuitive to think that low dose is overstimulating, and then I tell you to go up on the dose, and you say, what do you mean? My child's already bouncing off the walls, and now you're going to give him more. That's kind of a hard concept to accept, but we know, again, that higher doses are often more calming. In terms of reported benefits, in this particular study, they saw less agitation, less rage attacks, better sleep, better focus, less tics, and less seizures in those children who had seizure disorder. And interestingly here, in terms of other medications that they were taking, so antipsychotics, anti-epileptics, antidepressants, hypnotics and sedatives, and anxiolytics, you can see this is the first number, is the number of patients that were taking, or that changed, and the in parentheses is the percentage. So 20% of patients were able to stop taking antipsychotics, 13% were able to stop taking anti-epileptics, 30% antidepressants, and so on. This is very nice numbers in this group. Many patients did not have a change in terms of increasing dose or new medication, very low numbers. So you can see that cannabinoids, because they do have multiple targets and have multiple ways of working in the brain, may actually help with numerous different parts of autism with, one type of medicine, cannabinoids, as opposed to having all these other classifications of medications. And then here, this is quite interesting too. So this is the dosing. So basically what this is the dose of CBD in milligrams, so 15 milligrams all the way up to 285. On this side, you see the number of patients. So here we see 3 patients were taking 15 milligrams, and this was mostly 3 times a day dosing. And then you can see kind of the most patients were taking somewhere between 45 and 75 milligrams 3 times a day. But as you can see, some patients required much higher dosing. And so it's important to understand that for CBD, there is this very wide range of dosing. There's going to be patients that respond low dose, medium doses, and those that require high doses. So that's why we say start low and go slow. And to steal from my friend, Dr. Dustin Sulak, don't be afraid to go higher dose. So it's important. You can't say, gee, my child's not responding and I'm giving 50 milligrams 3 times a day, when you can see that there were numerous patients that needed much higher doses of that. And I know it can get somewhat costly, but at the same time, we cannot rule out the efficacy of CBD without trying high doses if you do not see the desired outcome at lower dosing. Now, here's another report that came out February of 2021, which was cannabinoid treatment for autism, proof of concept randomized trial. So there were 150 patients between the ages of 5 and 21, all with autism. Almost 80% considered severe, 88% had low adaptive levels, and 72% of the patients were on other medications. This is the first placebo-controlled double-blind comparison of 2 different oral cannabinoid solutions. So basically, they looked at whole plant CBD to THC. That means all the compounds in cannabis, including all the terpenes, the flavonoids, the minor cannabinoids, basically what you might call artisanal cannabis, what's available if you go to a dispensary or to a CBD store, and then purified. So isolate, meaning CBD and THC in a ratio 20:1, both were 20:1, but that has no other compounds in there. It's just CBD and THC. And what they saw was no severe side effects. Common side effects that they did see was some sleepiness, decreased appetite, tiredness, anxiety. But this is how they did the study. So they took the 150 patients and they put a third on placebo, a third on the pure cannabinoids, and a third on the whole plant extract. And they did a treatment for 12 weeks, as you can see here. And then they did various baseline evaluations and then all types of scaling. So clinical global impression, home questionnaires, and so on. Then what they did after the 12 weeks was they did a 4-week washout, not on anything. And then they switched over so the placebo patients got whole plant, the pure cannabinoids got placebo, and the whole plant patients got pure cannabinoids. And so notice that each 50 was always on did try some cannabinoid medicine. And this is what they found is that when using the whole plant, so this is percent participants with a positive response, and then you're looking at the numbers. They had a few patients that were not included, but close to 150 patients. The whole plant extract performed the best with 49% getting a positive response. Which is very similar to some previous studies that showed about 50% of patients respond to the 20:1 ratio. Many of the patients who don't respond, then when you add in a little extra THC, you get a better result. Those patients may have more of an anandamide deficiency and need more THC to help overcome that. But interestingly, in this study, they found that there was a statistically significant finding that the patients on whole plant, this was a real response compared to placebo. With the pure cannabinoids, it did not achieve statistical significance, but there was certainly some benefit. And what we look here, participants whose behavior problems either much improved or very much improved. So that's what we're looking at here. And that's so important to see the whole plant extract versus the pure cannabinoids and the placebo. So now we have some nice evidence showing that CBD with little THC in it can benefit these patients. Additional findings. So they noticed there was a decrease in the body mass index. And so participants who had higher BMI at baseline had a more prominent decrease in the BMI following cannabinoid treatment, which is important when you think about the pharmaceuticals being used to treat autism often have a terrible side effect of significant weight gain. And so this was actually the opposite. The participants who had the higher BMI had a decrease in BMI. And why is that? We know cannabinoids are very involved with appetite and energy metabolism. And, you know, people joke around, oh, you get munchies, so you get fat from cannabis, but it's actually the opposite is true. You are much less likely if you are a cannabis user to have obesity compared to someone who doesn't use cannabis. That's from a study. Males were much more likely to improve on 2 particular type of autism scales. Younger children were more likely to improve on 2 other, the severity scales and the improvement scales. Whole plant extract treatment remains significantly associated with improvement on 2 of the scales after controlling for somnolence and also for the concomitant use of other medications that these patients were taking during this study. Somnolence was more common in those on chronic medications. Well, of course, because if you stack medication that makes you sleepy, you are more sleepy. And that was statistically significant. One of the scales results provided preliminary evidence that cannabinoid treatment might improve core symptoms. Now, I see that in my practice, that parents say my child's more social, eye contact is better, we're seeing less of the repetitive behavior, less rigidity. However, it's nice to have a way to measure this using these scales. And then the average treatment dose during the first period was about 5.7 plus or minus 2.6 milligram per kilo per day. So remember, you would take that number, multiply it, time the kilogram to get the daily dose. And that was for the whole plant, and very similar dosing for the pure cannabinoids arm. Now, here's another report that came out last year. So medicinal cannabis in children and adolescents with autism spectrum disorder, looking at what's out there. What is the research saying now? Looking at all of the studies that are out there, and they included 5 completed studies and 5 ongoing studies. And what they found was all studies reported substantial behavior and symptom improvement on cannabis. And this is what we're seeing in the real world treating these patients. 61 to 93% based various studies of the subjects were showing benefits. And in 3 studies reporting on concomitant, meaning same time taking psychotropic medication use, up to 80% observed a reduction in other medications. Now, adverse effects were reported in 27%. I'll share with you that, again, in a study, there's kind of a protocol that you have to be on. And if your child gets side effects, they document that. In the real world, we see side effects and we pivot and we try something else. We change dosing, we change the product, we change the cannabinoid makeup. We don't have to put up with side effects in the real world. In studies, though, you're going to see this. And 2 patients in these 13 studies looked at did have psychotic symptoms. That was likely not from CBD. It likely was from THC content, or it could have been a drug-drug interaction between the drugs that they were already taking, the medications they had been prescribed that they stayed on when cannabis was added as part of the study. Now, I want to talk about some research that I'm doing with a company called Camformatics. We published 2 papers on what's called cannabis responsive biomarkers. One was published in December 2021 and the other one in early 2022. And what we were trying to do with these studies is to look at objective data that might show us exactly what medical cannabis is doing in children with autism. And so the study design was 15 children with autism who were on medical cannabis treatment for at least 1 year. And many of these patients had a personalized cannabis regimen, meaning we started them on CBD, and then depending on their response, then we tried THC or one of the other cannabinoids like THCA, CBDA, or CBG. And basically, each child was on a regimen that seemed to suit their response, that worked best for them. What we did was, before giving their medical cannabis treatment in the morning, the parents did a behavior survey, and then we collected saliva, which is how we measured the biomarkers. Then they were given their medical cannabis treatment. And then what we called peak was around 90 to 120 minutes after they got their medical cannabis treatment. The parents did another behavior survey, and we collected saliva again to look at the cannabis responsive biomarkers that Camformatics had already discovered. We used 9 typically developing children, meaning children without autism. We collected their saliva, and that allowed us to establish a physiologic range of these biomarkers. And what are these biomarkers? So these are chemical compounds that are found. You can find them in saliva, in urine, in blood, in tissue, human tissue. And what they are chemicals that reflect certain pathways, certain chemical pathways involved in neuronal dysfunction. So even the imbalance in the endocannabinoid system. We have biomarkers looking at pain response, looking at aggression, inflammation, and many other pathways. So by collecting the saliva, we measure the biomarkers, and then what we're able to see is how did they change from before the child got their medical cannabis to after. And the way I want you to think about the physiologic range is that, so for instance, if you go get a blood test for your doctor wants to check your white blood cells, between 4,000 and 12,000 is considered normal physiologic range. So let's say you get back a white blood cell count of 20,000, obviously something's going on, and this stands out as an abnormal test. It's probably, maybe you have an infection, so your white blood cells went up, and that is a good response, but it gives you information as to what's going on in your body at that time. And so the typically developing control children without autism allowed us to set a range so we could see what is to be expected in these patients. And so let me show you here on this slide. This is just 3 of our older patients in our group. By the way, we used ages 6 to 12. And what you can see here is this arrow going down is the physiologic mean determined by the children without autism. And this -2 to +2 is -2 standard deviations to +2 standard deviations around that means, kind of that range of what we would expect. And all of the children without autism all of their biomarkers fell within this kind of teal colored range between -2 and +2. Now you can see with our patients who have autism, before getting their medical cannabis treatment, all of these biomarkers that are listed here are many of them are completely out of whack. You can see they're significantly above +2 standard deviations from the mean. You can see all 3 of them have basically reflecting chemical pathways that are not within that physiologic range. And then what we see is after they take their medical cannabis treatment, fairly remarkable results that their biomarkers seem to shift towards the physiologic range, meaning the cannabis goes in and kind of helps balance these chemical pathways. Now, this is very early data. This is very preliminary. We are right now working to gather more patients to get more results so we can really get a very large, robust understanding of if this holds true for most of the patients who have autism. But certainly these preliminary results are quite remarkable. And then we have from our second paper, we found that medical cannabis treatment optimized the levels of certain cannabis responsive biomarkers in 94% of our subjects. And so what you can see here, A1 is patient 1, patient 2, and so on. So each one of these little kind of lines across, this little window across row, are the patient's results. And as you can see, again, many of the patients have these particular biomarkers. These are fatty acids out of whack. And then again, after the medical cannabis, you can see that the treatment seemed to shift the chemical biomarker pathways kind of back towards the physiologic range. And as you can see here, the blue represents the optimal, the -2 to +2 is our physiologic range, and then red is our symptomatic, which correlated too with our behavioral surveys. And so very interesting research. Again, we're only in the beginning of this, and we're planning to do further studies. And if you're interested in this, please feel free to go to canformatics.com to understand just exactly what we're doing here. Now, moving on. So this is what I see in my medical practice, the benefits of cannabis treatment. This is reported by parents, and I trust parents' reports because they're living with a lot of challenges. And this is what they tell me: less anxiety, less aggression, less temper tantrums, less self-injurious behaviors, less rigidity when transitioning from one activity to another, less stimming behaviors, better sleep, better speech and communication, better focus. improved school performance, less food rigidity, improved eye contact, and improved participation in therapy. Even if you were to only get one or two of these things with your child, with a medication that can be dialed in to the point where you have no unwanted side effects. Certainly, as I've shown you, the research supports the use of cannabis, especially for those patients who are having really severe challenges. Now, in terms of side effects, as I've mentioned, you can have increased restlessness or hyperactivity. Sometimes that's just due to how much CBD someone is taking. Somnolence. Now, often when you get to higher doses, you can see somnolence. And if it's something you don't want, then we pull back on the dose and we try another cannabinoid to fill in the gap to see if that combination can give the better results without this side effect. Sometimes when going up on CBD, some children are very sensitive and they just have this kind of sleepiness for about a week or so, a little more kind of more mellow. And then it kind of wears off as they get used to the dose. So I often see that this will resolve within a week of changing a dose. Sometimes children are over emotional. Remember that cannabinoids are targeting multiple places in the brain and body. When you target multiple receptors or mechanisms, we may get something we don't want, which is being overly emotional. I have seen this in some of my patients. And then it's not very common, but I have seen it. And then often you can see impairment or intoxication depending on the THC amount that your child is getting, whether it's by itself or within a other preparation like CBD to THC ratio products or with THCA. But very important, understand that you can minimize side effects. They are temporary, they are reversible, and they can often be resolved by changing the dose, the product, or the timing. Now, also, let's talk about some considerations for these patients. One size does not fit all. If your friend's child with autism that does great on CBD, it's like 50-50 that your child will respond to that. Even though children may have very similar symptoms in the same checkbox diagnosis, the response is individual. The endocannabinoid system is complex. These compounds also target outside the endocannabinoid system, so it's very hard to predict a response. As I alluded to before, there are what we call biphasic effects of CBD. Lower doses can be overstimulating. They are not always, but they can be. Higher doses can be more calming, sedating, and focusing. So if low doses aggravate the condition, I often tell patients you must try the higher doses, or you can add in THC to help balance that overstimulating effect. But in general, I mostly try higher doses unless we're at a high dose and it's still overstimulating. But let's say we are seeing some other benefits, we may just lower that CBD THC ratio to try to minimize that overstimulating effect. Combination of THC and CBD, as you could see with one of those studies that was using the artisanal, but in addition to flavonoids, terpenes, and other minor cannabinoids, the combination often gives better results by addressing more symptoms. And I often fill in gaps with CBG, CBDA, and THCA because we get this synergy. And I often find that when you're using multiple cannabinoids, you can also get away with lower doses. Remember that children are moving targets. They are growing and changing every day. That's what they're supposed to be doing. And dosing and cannabinoid combinations that have previously worked may need to be changed and adjusted as the child grows, especially as puberty starts to come on. Initially, I tailor the treatment to the one or two symptoms that are most concerning based on the parent report. And I tell everybody, please manage your expectations. There's all this wonderful, oh, cannabis, CBD can fix everything. It's not a cure. It's one puzzle piece. And just, don't expect too much in the beginning. But also, if you see a partial response and your child is doing well, but you haven't tried other types of intervention, such as like changing your child's diet. And I know it's very difficult in children with autism, but I have patients who, once cannabis seemed to be working, the parents felt more kind of determined or more motivated to now try a gluten-free diet or a dairy-free diet or sugar-free diet or combination to see if they could maximize the benefit. And often, remember, the gut is so important. You can't ignore your child's gut. And so I often encourage people to try other things that may help balance the gut in addition to cannabis as a kind of a whole regimen. It is not unusual for families to try multiple products, like 10 products or 15 products, to find what's most effective. High doses may be needed. So if you're not seeing anything at all at low dose, you must go higher. You may be missing the dose at which your child responds. Remember too that these compounds are very poorly absorbed through the gut, and sometimes very high doses are needed to overcome that poor absorption. And lastly, cannabis treatment takes time to change neurochemistry. It's not magic. A friend of mine, Dr. Kevin Spellman, who's an herbalist and a botanical medicine guru, says that plant medicine nudges you in the right direction. It's not like a hammer hitting you hard. So you have to give cannabis treatment time. It's interesting, there's a number of studies that have come out that show like the 3-month is very important, meaning it took patients 3 months. This is like in Parkinson's, chronic pain patients, some other studies that showed that if you hung in there, you started to see really good results around that 3-month mark. So this is, again, not magic. You have to give it a chance to work. And then one last thing. So in my book, I talk about ruling it in or ruling it out. So how do we do this? So you start with one product at low dose and you titrate up looking for the desired effects. You have ruled it out if there is no dose that helps symptoms. So a low dose, medium dose, or high dose. If you have not found benefits or you've seen negative side effects despite using low, medium, or high doses, you have ruled it out. You can move on to another product or cannabinoid. Now, remember that plant medicine is complicated in that the plants grown on one farm are going to be different than the plants grown on the other farm, even if they're both, let's say, a 20-to-1 CBD to THC. Yes, we can measure that, but we're not looking at all the other compounds in the plant, all the terpenes, all the flavonoids, all the other hundreds of compounds. So products from different companies, different growers, are by definition different. So if you try one brand of, let's say, a high CBD, low THC, if you try low, medium, high doses and it doesn't suit your child, it may be worthwhile to try another very similar type ratio, but from a different company or grower, because it is by definition going to be different. If you've ruled in a product, that means you found a dose that helped the symptoms. You're going to observe for a few weeks so you get a really good picture of what that particular product at that particular dose is doing, and you can adjust little by little. And then after you see the full effects, is there room for improvement? Do you want to try something else added in? And what you can do then is stack another cannabinoid. Let's say you first try CBD, but now you want to try CBG on top of that. You already know now your dose of CBD. You can add in that CBG on top, low dose, titrate up, leaving the CBD by itself. My general rule of thumb is one change at a time. Once you make a change, you have to give it a chance to work. Some people will power through a negative side effect, because I have had reports of patients saying after 2 or 3 days that unwanted effect, kind of like somnolence or maybe some escalated behavior that's not too bad. But if you see something that's really terrible, my general rule of thumb is to go back down on the dose or take it away for a few days and then reintroduce and see if you see the same thing. Because sometimes it can be a coincidence, sometimes it can be from that particular product. All right, and so that's the end of the talk. And I just want to thank you for your time, and check out my other YouTube videos. Cannabis is Medicine is the name of my book. And if you like this content, consider getting the book for you, your loved one, or even your physician who may need to learn about cannabis. Bye.